Hi, my name is Vivek Narayan from the University of Pennsylvania, and I'm happy to be here to present this year's prostate cancer update from ASCO. It's certainly another impressive year at ASCO for prostate cancer research and clinical developments over this past year, with a number of important trials presenting some compelling data. I think the highlight this year for prostate cancer was the plenary presentation of the randomized phase 3 VISION trial, which evaluated the novel PSMA-targeted radioligand therapy, lutetium PSMA-617, plus standard of care therapy versus standard of care therapy alone. This therapy was tested in treatment-refractory patients with metastatic castration-resistant prostate cancer, and it demonstrated improvements in both radiographic progression-free survival as well as overall survival. So as we await regulatory review of this novel agent, I think a number of clinical questions arise. First, we'll need to determine the optimal use of PSMA PET imaging for trying to select patients with this agent who are most likely to derive optimal benefit. And additionally, there will undoubtedly be some logistic considerations with how we make this novel therapy and technology available to our patients with castration-resistant disease. The second key data set presented this year was the initial results from the randomized PEACE 1 clinical trial. So this was also a large phase 3 trial that tested standard of care therapy for men with de novo metastatic castration-sensitive prostate cancer, plus the experimental interventions of abiraterone and prednisone and or prostate radiation therapy in a 2x2 factorial design. The initial results were presented at ASCO and focused primarily on the abiraterone exposure, particularly in those men who were receiving docetaxel chemotherapy as part of their standard of care systemic therapy. So in other words, the question that was sought to answer was to evaluate the role of triplet therapy with ADT, docetaxel, and abiraterone versus ADT and docetaxel alone in metastatic castration-sensitive disease. So here the authors reported a really impressive radiographic progression-free survival benefit with this triplet regimen, although the overall survival data remains immature at this point. So I think this data is very compelling, but the practice-changing impact, I think, remains to be seen, as the optimal approach for de novo castration-sensitive metastatic prostate cancer is still largely undefined. And I think certainly the overall survival outcomes will be eagerly awaited.